Jim Joyce.
Hey, hey, hey. Happy
Man,
Wednesday.
happy Wednesday. And I was just thinking about it, given Christmas coming up, given New Year's week. So like
Right.
the 24th Wednesday we've canceled. The week of New Year's, the 31st, I think, is the Wednesday. So
Mm,
today and next week will be our last two episodes. So got
exactly.
some amazing guests.
We guide the world. We guide the world. We go
We
from
guide the
CEO,
world. I love it. I
CEOs of
love that.
CEO of Walgreens to smell health tech to AI research with Alette to, what magic have you pulled off this week, Eugene? Who do we
Wow,
have coming
you're pretty
in?
good. Well, we have an amazing guest coming in, but before we get there, for all of you watching, hit subscribe, pass it on. Jim and I love doing this, so spread the love, spread the happiness. We've started doing a little bit of like happy, heartwarming news of the week because just everything sounds. And honestly, I didn't have the chance, but I kind of realized that I'm wearing, or is it Happy Human sweatshirt, and
Lovely.
the A in the middle is actually your coach, right? So you gotta have it.
Amazing. That's
Human to
your
that's
that's
ours.
your
Yeah,
sweater.
yeah,
I
yeah.
love it.
That's our
I love
that's
it.
our
I
happy
love it.
human thing. So
And I have to say, I think you saw online that I ran this kind of arts and jazz
yeah, that's right. That's
conference in
right.
Dublin, and
Yeah,
it
that
was
was
like
awesome.
I think it was the pinnacle of my career with like everything I said, a jazz band played a tune behind it. It was just I was like I found my true calling.
Dude, we're like, I don't know, kindred spirits, right? You did that, and then Stefan Malka, who I've known for many,
Mhm.
many years, he asked me on his podcast. I had so both of our artistic heads, like my head just lit up. I was episode number two, and I loved
Yeah,
the premise of it. The end of it is a podcast recording. But then
right,
through that podcast, he was asking about the like verse one, verse two, et cetera. And then there's
right.
a separate actual Spotify track on this. So love
Amazing.
the concept. Keep going. I saw there's already episode four, so I don't feel as privileged
Isolated.
anymore and isolated. But that was good fun.
Well,
So
I
both of
think
us, you're jazz. We're
yeah,
producing Spotify songs. So
right. I think it's so interesting that, because obviously, I play an advisory role with the crowd Sync Fit. And
yeah.
so where I'm exposed to kind of how to introduce music as medicine, but
Oh yeah.
this whole concept, kind of constantly, like every week we're thinking about that. But this whole idea of, how they all meld together, the creativity, like the human connectivity, even for Clear IP,
Yeah.
this idea
Yeah.
that you're constantly in a state of exploration and, whatever triggers fresh thinking, fresh thoughts, new ways to convalesce ideas.
We can use a little help all the time, right?
Exactly,
So
exactly. So with that,
on that, I we've been trying to get Amy on with us for quite some time, just schedules and all of this. And I know I certainly been looking forward to getting that bolt of energy from Amy on this Wednesday.
I could feel it just from the smile. Like I feel the bolt of energy, just like
Did
travel oceans,
did you two meet
Thank you
ever, by the
so
way?
much, guys. Just on LinkedIn. Hi,
just on
Jim.
Okay.
LinkedIn.
Okay.
Hey,
Hi,
Okay.
Amy,
Eugene.
Welcome,
great to
welcome
meet.
to the shot.
Thank you. It's great to be here. I'm
As
honored.
as we were letting you in, I know we've been trying to coordinate it, but crazy schedules and move stuff around. So we appreciate you being here. And I think for the millions of listeners and viewers that we have, we want to get to know Amy and take us all the way back as far as you want to, you know, personally, professionally. We'll interrupt throughout and reconstruct your life at the end of this.
And at
I
some
Not with
stage,
AI, not with AI.
at some stage, we have to unpack what's behind your here because it looks awesome. I don't know. I'm looking into your cabinets.
I love it, and I would love to do that. One of the things I love is interior design. So thank you, Jim.
Okay,
Well, Eugene and Jim, thank you so much. I will go but way back, and
way
maybe
back.
I'll just start about
Yep.
who is Amy. I am the
Cool.
oldest of four kids, and I grew up in Rockford, Illinois. So
Okay.
part of who is Amy is I'm the big sister, and that archetype lives today. In fact, as we get ready to go into the holidays, I become, kind of the coach and cheerleader for my family crew as it's gotten much larger.
Yeah.
Amazing.
My dad is a doctor. He was a family practice doctor for 42 years in Rockford. My
Okay.
mom's a nurse. And so, from a very early age, I knew that I wanted to be in healthcare. And there was a time where I maybe even wanted to go to medical school, but I ended up getting a business degree. And, that kind of set my foundation. I've spent my whole career in healthcare.
Okay.
So when I first
Amazing.
graduated undergrad, I carried a bag for a little startup company called Medaflex Hospital Products. I
Oh.
finished my undergrad on a Thursday, and I was in Philadelphia on a Sunday with Bob Lutkovity, who was my field trainer in Philadelphia, learning how to sell. I mean, he literally picked me up at 4 a.m. on Monday
Wow.
morning, the first part of my career, and took me to hospitals within New Jersey. We were listening to trash radio, and I was like, what in the heck just happened to this little lady from the middle of the United States?
Yeah, yeah.
But
And where did you go to school?
I went to undergrad at Kent State University, which is in
Okay.
Ohio.
Yep.
um, I'm not much of a follower, but I followed my high school sweetheart, and so that's the reason I went to Kent. I ended up marrying that guy, and we had 2 kids together. We're not married anymore, but we're good friends. So maybe more on that later. But yeah, so I went to Kent State University for my undergrad.
Okay.
And if you don't mind, take back like to Amy in high school.
Yeah.
Did you have like just all sisters, brothers? What was the family dynamic?
Oh yeah, Jim. So I'm the oldest of 3 sisters, and then we have a baby brother.
Ooh.
So yeah, so we're 10 years apart. So Amy, then Jenny, who's a graphic designer, my sister Sarah, who I've posted a lot about. She writes cookbooks and worked for the Food Network, and is in New York City. And then my brother Tim works for Medline. He kind of followed in the family
Okay.
tradition, and so
He had
all of us
four.
spread across the country, 4 of us.
No, he had four mothers. He had
He
four
had
mothers.
4. Oh, that's so funny, Jim, that you say that, because we would say mom was the primary mother. I was the secondary mother. Jenny
That's
was the
funny.
tertiary mother. So
Right.
yeah, yeah.
Yeah, because I have in my family I have four sisters and a much younger baby brother, and I just watched how he was tended to growing up. It was
Oh yeah.
fascinating. Yeah, I
Did
kind of
he ever
escaped.
have his, yeah, did anybody ever curl his hair?
Oh yeah, yeah, like yeah. He's got
Right.
yeah. It was all kinds of like he's a fantastic human being, but it was created and yeah, there was kind of it was
We love our
I,
baby brother. So yes.
so let's take you back to 4 a.m. car ride.
yeah.
Yes. So we're 4 a.m. car ride. I'm working for Medaflex Hospital Products. I'm with Bob. He's my trainer. And we are driving to hospital in New Jersey. And I'm in my first sales job. So what I did is I sold skin prepping products, antimicrobials, to
Hmm.
hospitals for the purposes of reducing infection in IVs and having good blood culture results. It's amazing I can still say that after 32
Wow. I
years.
was gonna say that's a
Um,
tongue twister
yeah.
by itself.
And
And
Who were they up against? Who was Mediflex up against?
yeah, so Mediflex at the time was up against like the old fashioned, using an alcohol pad to
Oh
scrub the
wow.
skin. And our value proposition was do a better job of that prep, and you can ultimately improve outcomes for your patients.
Okay.
And we had a very simple but effective ROI analysis that I would do on a sheet of paper. It was pre-printed, and we would walk the
Uh,
person through how to drive the savings that they could expect if they invested in Medaflex.
right.
And we sold really 2 hospitals. This is
Right.
before mobile phones, so I'm dating myself a little bit.
Sure.
I literally had a leather detail bag. So some years later, as a sales leader, I said something to my whole team when I was carrying the bag. And I
Right.
looked out into the audience, and I realized that my team didn't even know what I was talking about. Like, what do you
Right.
mean carrying the bag? Right.
Yeah.
But
Yeah.
I literally carried
But
the bag, a leather detail bag with
it's a
products and
deep,
brochures inside.
it's a deep honor. It's a deep honor
It
to
is,
say you carried the bag.
without a doubt. I feel really honored. So at my heart, I'm a sales guy.
Right.
I love to sell. I worked for Medaflex for 4 years. I kind of went up through the ranks and was a rep and then a trainer. And then I was a region manager. I won a President's Club award. So that's one of my
Aha.
trophies. Went to
Ooh.
Hawaii with the president and his wife.
Yeah.
And, that kind of set the seeds very early that I love healthcare. I love to sell. I love buyers and I love winning.
Right.
And I probably would have never left Medaflex, but we sold through Baxter. Baxter was our
Hmm.
distributor, one of them, and the
Okay.
Baxter folks recruited me to come and join Baxter. Another driver was they wanted to move me to Philadelphia, and my husband at the time was an airline pilot for TWA. He was stationed in New York City, and so it made sense for us to move to the East Coast. We were Chicago
Yeah.
people. So we
Yeah.
picked up and we moved, and I transitioned to Baxter, which I loved. And
Right.
that started 14 years of being with
Wow.
Baxter. And then it became Allegiance Healthcare. We spun off from Baxter and we were Allegiance.
Okay.
And then ultimately we were acquired by Cardinal Health.
Okay.
And so during that time, I was a rep in the field for them in Philadelphia. Then they moved me back to Chicago and I did a marketing role.
Okay.
Then I did a startup within Allegiance, which was really
Oh,
exciting. It
wow.
was kind of like off the side of my desk. I was a marketing manager, but we also did a startup within the company.
Hmm.
It
Oh, wow.
was a consumer first aid product called the ER
Okay.
system. We partnered with the National Safety Council, and that
Interesting.
was
Yeah.
incredibly exciting. At one point, I had more than 100 people at Allegiance that were on my ER system team, but none of them reported to me. They
Right.
were all, just excited about the movement and this startup that we were doing. And we drafted them in and everybody worked together.
So
You know, it,
inside, like kind of what you did, Eugene, right?
yeah, I mean, a little bit of the Bayer buyer gig, right? But
Yes.
yeah, but it's interesting because I was going to comment on it, right? I think there's obviously, there's the intrapreneur and entrepreneur because to your point, I think people get excited about attaching, there's a salary involved over here. The risk minimization is still there for those individuals. And it's a sexy thing, right? To
Yeah.
work on a startup within the corporate umbrella. Now, if they let you fly solo outside without the corporate umbrella, right? Even though with investments, that starts changing things. And then you kind of like, who's still standing in line here to join me? Right?
Eugene, without a doubt. Yes, without a doubt. And eventually we did bring some of those people into a formal team.
Yeah.
I moved out of my day job and did the entrepreneur role full time.
Okay.
I owe a ton of credit to Bill Saxelby, who was one of the Allegiance ELT at the time. And, Bill's a great visionary, still a dear friend of mine today. And we made a huge go of it. And then we ended up divesting in a good way. We exited that business, which was good for Allegiance. We also got acquired by Cardinal Health,
Oh,
which
Okay.
I stayed and continued on in my next role at Cardinal. And I can tell you all about that. But that was an exciting time in
s-
my career.
so just to make sure, Allegiance spin out and then
Yes,
Cardinal, right? So you went as part of that spin out process.
I did.
And
That's right.
and and isn't it amazing that there's well, the few individuals in your life that really take a bet, not just on the idea, concept, business, but also on you as the individual, right? Like it's just fascinating.
Without,
It seems like they're always
without a
Bob.
doubt.
It seems like they're for
Oh,
you, they're Bob or Bill. Would you say Bob? Yeah.
yeah,
There's
that's
always a
right. So
Bob or a
far,
Bill.
it's Bob and a Bill. Yeah.
Okay,
And a
okay.
Daryl.
It's like they're like I get a Bob and a Bill. It's like get inspired by Amy and they kind of back you.
That's hilarious, Jim. I actually never thought of it that way. But, that's probably one of the most exciting parts of my career is the wonderful leaders with whom I've gotten to work. and learn, and they trusted me and they gave me more and more responsibility. And and I'm a go-getter, so I just would
Right.
continue to fly. And I have more story on Bill actually after Cardinal Health acquired Allegiance. Bill was made a ton of money on that deal, and he went off and
Okay.
became a CEO of another company. And for a year, he worked on me. He's like, "Come on, Aim,
Yeah.
come on over and join me. Come on, come on." And I'm like, "Hey, at the time I was leading a sales team for interventional radiology, which was a
Oh,
super cool space at Cardinal. I had, 80 sales reps. I worked with a cool guy by the name of Tom Dalton, who was my counterpart in marketing. And then he became the president. So he was my boss. And we were having a ton of fun. But at the same time, Bill just kept working on me. And this was
typical
in
Bill.
yeah, typical Bill. He's, yes, if you knew him, you would know that he's very persistent.
I had the
But this,
feeling. I had the feeling.
yeah, this was at the time in healthcare where CT was becoming more and more prevalent. And the early days of people getting burned with CT machines in
Mm.
hospitals. So we're talking in the early 2000s, somewhere around 2010, there were just a few incidences of this happening. And the company that Bill went to lead was a company called Landauer. So Landauer was based here in the Chicago area. At the time, I think they were 65 years old, publicly traded, and the closest thing to a bond you could find. They had like 30,000
Wow.
clients. They did a slight price increase every year. And what they did is radiation monitoring of
Oh,
people who get exposed to radiation. And that was
Hmm.
it. It was basically monitoring people, occupational monitoring. And so Bill convinced me to come and lead sales and marketing for him. This is way before the term chief commercial officer, but that's
right.
essentially what I did. I was an officer. I reported to him. I led the sales and marketing org. And man, when I got there, I thought, whoa, I think I just stepped back like 10 years in time.
Wow.
Interesting.
It was very old school. Like all of the reports were on these big printed files, and somebody asked me if I wanted coffee, and I was like, "Oh wow, yeah, that'd be great." Like I've been getting my own coffee for 10 years. And we turned
Well,
that
chief,
company into
chief
something
commercial
super
officer.
exciting.
Right.
Yeah, exactly. Yeah.
And what it,
So
You turned it into
yeah, so what we did was, very slowly, we partnered with medical physicists and different hospital systems around the country, and created a patient radiation dose arm of the business to address that growing need to have radiation safety for our patients. This was sparked by our friends over at HCA. So one day I
hmm
got a call from Chuck Hall, who was the president of HCA at the time, for one of the divisions. And he said, and we were on the health trust contract. He said, "Amy, I got a problem. I need you to help me with some radiation safety issues." And that led to 4-year project working with HCA, with Landauer, creating a radiation safety program. We ultimately went out and consolidated the medical physics industry, which, think of medical physicists like the doctors of radiology. They're the ones who keep everybody safe. And so we
yep.
created Landauer Medical Physics
Okay.
and put this whole business, really expanded the business into something that was thriving and growing. Was so much fun.
Was it
And
hard to do
then,
with the traditional culture or
oh yeah, very hard. I mean, very hard. I'll give you an example. I live in the northwest suburbs of Chicago, and the Landauer office is in Glenwood, Illinois. And Bill had convinced me that I could just work remotely, way back in the mid
hmm
2000s.
He was
And
a
I was like, oh,
visionary.
okay. He was a visionary. And then I came down to the office for my first day, and quickly I learned that this was not a place that was going to take kindly to somebody who
right?
was
Check
working
it.
remotely. And
Right.
so I drove an hour and a half one way every day for 5 years just to
Wow.
build trust and
Mm-hmm.
camaraderie with that team that had been there, some of them for 15 or 20 years. Took a
Wow.
while.
Would you say, kind of startups use the word pivot, right? Which I'm not necessarily a huge fan. Like to me, it's really about listening to the market and the customer and taking what you have, right? And yes, you can argue it's a pivot. I don't know. Would you say that that was a pivot? Like, how would you classify moving, and how many people in the organization, Amy, roughly? I mean,
About
just order of magnitude.
400
Okay, so
people,
pretty
yeah,
significant size company, right?
significant size. Yeah, yeah.
What was that effort? First of all, how long that took, and then,
Hmm.
I mean, changing the business model as well, I'm assuming, right? I mean, there's so many
Sounds
moving
pretty
parts.
transformative.
Yeah.
Yeah, yeah. So to kind of start it off, Eugene, it's a great question. The duration of time between when I joined and when we did our exit and sold the company, we took it private with Fortive, was 9 years.
Okay.
And so the first year for me was really about establishing credibility as their sales
Yeah.
leader and rationalizing who was in, who was not in. Um, they decided at the last minute to keep the sales leader who was there, so he reported to me. That's tricky.
Yeah.
And so that first year was kind of like what we would all know is the traditional type of things. And at the same time, like deeply studying the literature, understanding what is this deal with all these radiation burns, listening to the customers, figuring out what we could and couldn't do. And so
Right.
that was really the first 3 years. And then, I mean, really the HCA need that they had was a lucky break. But
Hmm.
then I listened to it and we just got all over that and partnered with them. um, Kind of a cool thing is we created a playbook for all of the HCA hospitals around the country, and we created 26 different parameters that they had to follow in order to be safe with radiation. And HCA for sure was leading the pack in this area. Somebody
Amazing.
from the Joint Commission got a handle of that book, and they created the requirements from the Joint Commission that basically mirrored those things.
Hmm.
And so, I mean, that was like luck meeting
Right.
opportunity, right? I mean, and then all of the hospitals in the country had to comply with those radiation safety guidelines.
Isn't
So
everything
really cool.
luck meeting opportunity and hard work? I mean,
Oh yeah, for sure.
But I'm
Without a
dying,
doubt.
and I apologize for this in advance, but this question,
Yeah,
but I want to get a visual. I just want you to give me a comparative visual here of
yeah,
4 a.m.
yeah,
Philadelphia meeting Bob,
yes,
and then I want
yes.
to talk about walking into to the new startup, whatever. So what was Bob in a full suit? What kind of car was he
Oh,
driving when you walk in?
oh my gosh. I love this question, Jim. Here's why. Yes, Bob was definitely in a suit. I'll explain my suit because, of course, I
Yeah,
was 22. I
right.
literally actually hadn't even graduated from college. Like they had, no, sorry, I did graduate and I literally started on the next Monday. I
Yep.
think I was wearing like the classic casual corner navy
Yeah.
blue suit. I
Right. Yeah.
probably had like a big bow tie, because that was back in the early 90s, you know, pantyhose and heels when it was kind of cold out.
Right.
And Bob was driving a Pontiac Bonneville. And the reason I know that is because that was our company car.
Right.
So I too had a Pontiac Bonneville
Okay.
with a built in mobile phone. Like we didn't
Right.
have mobile phones at the time, it was a
Right.
car
That's
phone.
right.
And we were told that we could only use it for an emergency because it was like $3 a minute for
Right.
the calls. So,
Okay.
yeah.
And then what was the coffee situation? Did you stop and get a Dunkin' Donuts and you were sitting there?
Oh, without a doubt. I mean, we stopped and we got a Dunkin' Donuts, a breakfast sandwich from Philadelphia. We drove to New Jersey.
Right.
We were listening to Howard Stern. I had
Right.
no idea who Howard Stern was. I mean, I
Right.
didn't lead a super
And was
sheltered
there
life.
maps? Was it maps or was it
Maps.
navigation?
Oh my
Right.
gosh, maps. I mean, I'm dating myself big time, but maps.
Right.
By the way, I love Rand McNally maps. I mean, I
Yeah.
had a map of every part of my sales territory with every hospital
Yeah.
marked on the map, highlights.
And then
you
the first
know.
day
I think I was a
was
Michelin guy. I was a
your
Michelin
Michelin,
Oh,
Maps
yeah,
guy,
yeah, yeah, yeah,
I
I
yeah.
love
think.
it.
And
Yeah.
then sorry to do this to you, but and then that
No,
first
I
day
love
was
it.
there 10 were there 10 meetings lined up like or something, or was there
Well,
like
if
what
Bob
was
were superstar rep, there would have been, but I think there were probably like 4 meetings lined up.
okay.
And
Yep.
then we probably added on another 4 or 5. I know
Yeah.
we went to 3 hospitals on the first day, which was pretty much
Oh,
what their standard was. You know,
yeah.
you drive there, you will get to at least 3 hospitals a day. You'll try and see 3 or 4 people in the
Yeah.
hospital.
And
And then at the end of the day, oh, yeah.
do you remember the first meeting with the doctor as you walked in, or the surgical?
Oh,
Like
you
how
know what?
informative.
It's so interesting, Jim, that you say that. I do remember because it was a female. She was the lab director at a
Right.
hospital in New Jersey.
Yeah.
And I remember Bob saying, "This is Amy." I was Amy Copeland at the time.
Yeah.
Oh, fun fact, my initials are ABC, always be closing.
I love
That's
it.
just God given. So
Yeah.
he's like, "This is Amy Copeland." And
Yeah.
I'm training her, and the
Amazing.
rest is history. The
Yeah.
first year I
Sorry.
didn't.
Thank you.
No,
Thank you for
no,
indulging me.
my
I love
pleasure.
a good farmer rep, like that proper, the proper,
Yes.
and then not to belabor the point, but then you're walking now into, what was the name of the startup that Bill was
So,
running?
well, so actually, it was Landauer, and it wasn't a
Okay.
startup at all. It was
Sorry. Yeah. Sorry. It's a
65
big
years.
public. Yeah. Sorry.
Big, yes. No, no, that's
He was
okay.
going on and leading this big company
Yes.
and doing a transformation, and then you walked in. So you walked into that scenario, and it was like I'm just picturing sheets of paper, and they asked you for coffee, and
And all the walls in the executive area were mahogany and desks. We all had our own office. Of course, he had the corner office. I had
yeah,
just driven an hour and a half to get there. I had been there for interviews, but
yeah,
my commute was a long commute through the Chicago market. And yeah, you walk in, there's a receptionist there,
right.
and then into the executive area. And it's very, very old school.
Love it, love it. No, thank you.
Yes,
Sorry, I'll take usually we'll
you're
take on
welcome.
our
I
normal programming, normal
No,
I
programming.
this
love
was a
that.
wonderful artistic interlude by Jim Joyce with his questions. I love it. I love it. All right, so
Okay,
let's you've pivoted the business, sold it to private equity,
Yes.
and then let's keep moving from there and some of
So
the
the
new.
Yeah, so the cool thing is I've got a ton of money. Now, by the way, I have these 2 little kids, and I've been a single mom for about 10 years at this point.
oh
I'm
wow,
living in the dream house that we built, and I have never not worked a day since I was about 13.
right,
And so we sold the company, and for the first time, I'm like, what am I going to do?
right,
And I actually took a little break. I trained with Team World Vision and trained
Oh,
for a half marathon. And I
wow,
did 2 triathlons and a half marathon that year. I
amazing.
met I met my husband Dave. So I'm happily married. I met Dave then because I thought, my kids are now like young teenagers, and they're going to be gone soon, and I don't want to be by myself. So I, for the first time, started dating, and that's when I met Dave. And what a blessing, thank God.
He's such a lovely guy.
um, oh, thank you, Eugene. He is the best. He makes me laugh. Yeah, he's probably listening. um, and I just took my time. I did a lot of journaling. I started a book. And then I got a little bored. And
right,
so, really, was my first big pivot, because shortly thereafter, and by the way, I had met Jim Pursley. We all know Jim
Yeah,
from Hinge and Livongo. I had met Jim at Northwestern. So I did some talks at Northwestern. I got an executive scholar certificate from Northwestern. And along the way, Jim was in one of the meetings that I was in, and we met. And at the time, he worked for GE Healthcare and I worked for Landauer. So we were kind of partners. He and I didn't officially work together, but we just had a nice rapport. We became friends. And if you fast forward to 2019, in 2019, Jim was working on building out the commercial team at Livongo. And of course, I'm a Chicagoan. So I knew by then
Glenn.
that Livongo was amazing. I read Cranes. I had followed Glenn, and I said to Jim, I really want to come to work at Livongo. So, if you have any cool opportunities that become available, think of me.
I'm in,
And the
right?
first one, yeah, I'm in. The first one we looked at wasn't really a good match. So I did something else for a little while. And then the second one, he said, Amy, I need somebody to come and run marketing at Livongo. I need somebody that thinks like a sales guy, but runs marketing. And I'm like, I can do that.
Amazing.
And so that was really my massive pivot away from selling to hospitals and health
Mm-hmm.
systems, which I had done for about 25 years at that point, to self-insured employers. And for me, I mean, once I got in there, I was like, my mind was kind of blown. Like, there's this whole other massive economy in healthcare that isn't hospitals. I mean, not that I was totally naive to that, but I just guess I didn't realize how much spend was over there. And so that's where my love and passion has been since I joined Livongo. And I'm excited to tell you all about the Livongo journey and what I've been doing since then.
Absolutely. But I'm curious on the culture shock, or just,
Yes.
I'll say, shock from the perspective selling to health systems, and then
Yes.
thinking through the model, because I mean, employers ultimately pay for a lot of the patients. I mean, we're all employees, we're
Right.
covered by insurance, insurance sells to
Yes.
employers. So
Yes.
what was that kind of like the shocking moment or aha moment as you sort of realizing, oh shit, employers, right?
Yeah. Well, so it was during my due diligence of learning about Livongo. It was twofold. First of all, until that point, all of my selling and marketing had been done to take people who are already sick and try and get them well. So
Okay.
Livongo was going upstream to try and prevent illness, right?
Mm-hmm.
Prevent chronic conditions. So that was one big pivot is we try and get them to not go to the hospital. And
Right.
then the second was this, massive spend from our self-insured employers. And so, of course, by the time I walked in the door, and I can remember like it was yesterday, my first day at Livongo, I knew that this was a totally different ecosystem. And we sold to hospitals too, but by
Right.
far and away, the big target market were self-insured employers.
Right.
And just, I don't remember, I guess when Livongo went public, somewhere around 2019, I believe. Um,
Yes. So
what
I
was
joined in
it?
May. Yeah,
Okay.
and then we went public within that year. So I had only been there for less just under a year when we did our IPO.
And
Amazing.
what was I mean, we had the pleasure of having Glenn, actually Lee as well on here. What was the culture like, right? Because again, you kind of went from selling to health systems, which I'm sure had its own culture. And I know every
Yes.
company is different, but still kind
Yes.
of from a customer base. What was the
Right.
Livongo culture like?
Uh, I absolutely loved it. Well, so first of all, from Glenn down, we all believed in the mission. We would, you'd need to be able to recite the mission at any time. I actually never got the pop quiz, but I could, we knew the mission. We all would take our blood glucose, even if we didn't have diabetes, just for the sense of feeling what it's like for our members, what the experience
Hmm.
Right.
is that they have. That was really embedded in us from the leadership. We would do calls to members on a monthly basis to talk to members and ensure that they know how to use their devices. So they would draft us all in to get involved with caring for our members and making healthcare better. A fun example of what our culture was like, and of course this was pre-pandemic. I worked in the Chicago office. Um, at that point, I think we only had one floor, maybe a little bit of a second floor in the building on Michigan Avenue, which is still a Teladoc building. And it was packed. There were people in, every single conference room was full, every single desk was full. It was an open concept.
Hmm.
It was really kind of bursting at the seams, and they delivered in food Monday through Thursday. And like clockwork, everybody would break and go for lunch. We would
Right.
stand up in the cafe, in the little lunchroom, and hurry up and eat our lunch and laugh and have conversations. And then just like the bell would have rung, everybody cleaned up and everyone was
Right.
back on the phones by 1 o'clock. So it was like a really intense but happy, like we're going after something really important type of a mission. It was
Amazing.
really
And
exhilarating. It was fun.
and did you stay through the Teladoc acquisition?
I
You
did.
did. Okay.
I did. So I actually was, leading B2B marketing. Thankfully, we had put in a demand generation system. So shout out to Susan Barkley, who was on my team. She and I had implemented a demand gen system. And I can remember one night I got a call from Carl Greider, who was like the COO at the time. And Carl said, Amy, this is highly confidential, but tomorrow we're going to get acquired by Teladoc Health, and we need you to send an email to all of our customers.
Oh,
Hmm.
wow.
And I was like, holy shit.
Glad
Right.
we
Okay.
glad we worked on that system.
I'm glad we have that system in place.
Right.
And Gary Alpert, who led the client team, love that man. Gary and I stayed up all night. So I think we were like the fourth and fifth people that knew about it, only because
Had
especially for me, Gary was more senior than I, but we were the
had
ones
to
who could
send the
actually
email.
make it happen.
Right.
And we sent the email.
Right.
But it took us all night to get it arranged, and we did it. And
Amazing.
so,
Yeah.
Amazing.
yeah, it was really fun. Eugene, to answer your question, I did stay, and I stayed. A lot of people left,
Yep.
and I stayed. I joined the marketing team with Teladoc Health, and I'm glad I stayed. At that point, I was leading the commercial advisory board, which was really important to me. We reinstituted that with Teladoc. So we created an employer advisory board,
Yep.
and I've stayed for another 2 years. So I was there for a
Oh
total of
wow.
4 years. And after a while, I kind of felt like personally wanted to keep the mission and the magic of what we delivered
Yeah.
as Livongo. I really wanted to make sure we continue. I felt a personal ownership to that.
Right.
I,
Right.
I, I do wish we scheduled 2 hours for this because there's just I think so many angles, even on culture
Right.
comparisons and all this, but we
Yeah.
still got quite a journey to get through.
Yes,
Your amazing journey. So you continued from there. You continued in the employer space,
I
if I'm
did.
not mistaken. Yeah. So tell
I
us a little
did.
bit how
So
you ended up.
So Lyra was looking for a head of sales and marketing, and I really became passionate about mental health when I was at Livongo. We had acquired a company called My Strength,
That's right.
so it was a part of the whole person solution at Livongo. Continued on with that at Teladoc, and I was in marketing uh, at Teladoc Health. But really, my A game is I'm a sales leader. I'm a commercial leader. And so when Lyra was looking for somebody to lead the sales organization, still have some role in marketing, but mostly sales, and it was mental health. And at this point, I'm, really involved in the business group on health and understand that there's a huge driver for mental health needs within self-insured employers. I couldn't help but jump at that opportunity. So I spent 2 years at Lyra leading the sales team, worked for Sean McBride, who is an amazing leader, David Ebersman, who founded Lyra.
Yeah.
I am a Lyra shareholder and was a Lyra patient. Everybody needs good mental health support.
Sure.
And it was a fantastic time there growing that business. And really, I'm just to be cautious of time,
Right.
the continuation of my mission of transforming healthcare is what led me here to Carrum. And so
Right.
maybe I'll just, end my journey a little bit on
And
my
we
time
can go
here at
back, by
Carrum
the
Health.
way. So
Yes,
yeah.
of
Yeah.
course. Absolutely. And so Carrum, of course, what we do is we're changing the way that healthcare is paid for and delivered. We're a COE company, a value-based care organization. And in many respects, I feel like this is kind of the pinnacle of my career because all of this, desire to transform healthcare is what I've done my whole career. And
Right.
really, this is something that Carrum is doing. And for those of you who aren't familiar with Carrum, what we've done and what our leaders, Sach Jain and Brent Nicholson, phenomenal leaders, they've spent the last 11 years figuring out how to create value-based care arrangements with the best hospitals and health systems in the country.
Okay.
So how cool is that? Going back to my roots.
Hmm. Hmm.
And
Right.
then delivering those value-based care agreements to employers that can allow their members to get access to only the top care in the world, for a savings. So now they can buy directly from Carrum, send their members to these top centers, and this is for surgery, for cancer care, and for substance use disorder. And people get better, and employers can save a lot of money with this approach. And so the timing again is great, because what are we all talking about right now with self-insured employers? Trend. The
Right.
trend is at least 9%, and buyers are trying to figure out, how am I going to offset that? And
Yep.
even, Carrum has been preparing for this for years. It's well positioned to help address this challenge right now.
And
And I actually
your
think the nine.
go ahead.
Sorry, I was going to say, actually, I think the 9% is the business group of health number. And if I'm not mistaken, I think that was kind of the pre-Medicaid cuts conversations, right? Because,
Yes,
the strong belief here is that those costs are going to be passed on to the employers anyhow.
right.
So that trend is
Yeah,
even higher, at
even
least
higher.
my hypothesis. Yeah.
Yes, yes. So I'm just finishing my first year. We have had an absolutely killer year. We had killer 2 years when I was at Lyra too, by the way. I mean, like, huge
Right.
success. Just this year has been so gratifying to complete. We actually just celebrated it on a call this morning. We
Good for
exceeded our
sure.
plan, both
Amazing.
in the ARR, the number of new clients, almost triple. We've almost hit 7 million members now here at Carrum.
Oh,
So
wow.
we have
Wow.
had a really great year. And as the sales leader, that's what I'm paid to
Amazing.
do. So it's been really fun.
And
Listen, first of all,
if you
kudos.
just, if you would think about, the next, if you had your dreams come true, where would you be in 2 years from now
Oh, yeah,
on that
that's
mission?
so great. Jim, I'm glad you asked that. What I would really like to do is go back to my entrepreneurial roots. So I
Mm,
probably will do that, because I'm really grateful to be serving on a board now, with your coach. I have several clients that were my clients in the past that would like for me to do some consulting for them. So
right.
in my perfect world, I would actually exercise my entrepreneurial spirit again, and kind of step out into the domain of doing, like, helping more Carums, not just one company, but maybe two
Right.
or three, and then
Right.
finish that book, which really I'm
I was
putting it
just
out
gonna
there,
say, I
because
was gonna
I
say.
mean, it's risky, because now I really have to do it. It's like telling somebody you're going to go on a diet. But
Yeah.
yeah.
And what's
Well,
the title? Can you share the title or the theme of the book?
Well, the theme of the book when it started was swagger. I really felt
hmm,
like,
Mm,
um, we as professionals, but especially women, fight confidence all the time. And especially for me, I did, even though I looked super confident on the outside, I'm, you're kind of pedaling as fast as you can underneath. And especially having gone through, a challenge with my marriage and being a single mom,
yep.
I'm a fighter. I'm super resilient, but I also needed to continue to keep my own swagger up. So my book started with the intent that it was going to be focused on swagger. Now, after having it sit on the shelf, maybe a third of the way written, and fast forward, I think now it's probably adjusted a little bit to the idea that you can be really nice. Like, people will always say to me, Amy, you're so nice. And sometimes that gets perceived as not tough.
Right.
And that's definitely not true. I am super tough and resilient. And so, I mean, I'm, kind of, I'm still working on it, but I think it will lean a little bit more toward, you can practice the golden rule and be kind to people and have a really warm and genuine heart, and still be
Right.
a killer salesperson and
and you
still
kill
win,
you kill more flies with honey, right? That's
Oh,
the
yeah. Yes.
I the cliche statement around it.
Right.
Yes.
But
Well, and especially when it's authentic. And that is, I actually had somebody, when I left Cardinal Health and went to Landauer, I had somebody say to me, Amy, when I first met you like 10 years ago, I thought, she's too good to be true. And now here it is 10 years later, and you're the same today as you were 10 years ago. And that really taught me something, because people underestimate me, especially when they first meet me, because they're like, oh, she's so nice. But is there really grit behind it? And there's a lot of grit behind it. So don't underestimate me.
Got it.
Listen, I think first of all, Maureen and I super happy to have you with us. I think you're, a wealth of experience, energy. I think as you popped on the screen here, Jim and I do this Wednesday, shot of digital health as a energy boost for the two of us. So we're very selfish about it. Um,
Love it.
I before we go into kind of Jim's big famous last question, I'd love for our listeners and viewers to understand you were selling to health systems, but what are the, and for the entrepreneurs that are watching, employers are a different beast. Maybe take us a little bit through that journey. I would say what in the last, let's call it half a decade plus ish,
Yeah.
on what you've seen, the kind of the big changes and how you sell to employers, the point solution. Everybody chose what one thing did best. So maybe kind of take us from your seat as selling in the front lines, what us entrepreneurs should be looking at and for, and lessons learned.
Oh, love that question. So let's see. Let me start with, I think all of us who spend time in the employer space, really anybody who's selling, we should be obsessed with our buyers. And so in being obsessed with self-insured employers, since my Livongo days, I give so much credit to our benefits leaders. That is a hard
Hmm.
job and a huge responsibility, because, of course, they're managing a massive amount of spend for the organization, usually one of the biggest in the P&L, but also something that is so personal. And so it's like that they have to balance the economics with the member experience. And if you can get those two things right, then things can really
Yep.
be fantastic for any company that can balance those two things. um, I think self-insured employers, from my experience, generally can only make maybe two or three big swings a year. And if they're changing their medical vendor or their PBM, maybe they might have the bandwidth to do one point solution, and now these days only if it's going to save the money.
Yep.
So, and then their sales cycle, the buying cycle, it used to be very routine. They would the jumbos would start right about now. They'd already have a pretty good idea of what their strategy is by January. They'd put everything out to bid, and really by the end of Q1 they would have made their decision, and we were contracting and then doing implementation and getting ready to go live on 1/1. But especially during my time at Lyra and now at Carrum, we found that so many of the buyers were making big changes, medical vendors,
Yep.
PBM, that it felt like the buying season got delayed a little bit this year. And so, literally last Friday, the 5th, was a big hurdle date for us. And we had huge amounts of contracts that were coming in, because we've got to get their files loaded and be ready to
Yep.
implement on 1/1. So the buying cycle has been compressed, and there's also more receptivity to mid-cycle launches than there used to be, I think. So those are
And
just
do
a
you, and,
few top of mind things.
and do you think the sales cycle got stretched now because of the uncertainty? Like, I mean, because
Sure.
there's been
Yes.
so much uncertainty in kind of the health
Oh,
policy, the costs
yes. Yes.
involved.
Yes, I think that's true, Eugene. Although at the same time, I think that there is a newfound bravery with benefits leaders, because they're like, I have to do something. I have to be
Yeah.
bold in order to offset this trend. And so that's where we felt so grateful, because when you have a really reliable solution like Carum that is well proven, but not, mostly by early adopters until recently, we can guarantee them that they're going to save money
Yeah.
and
Yep.
have no PEPM. So why not pull the trigger and do that, especially if they do some type of a mandated model where they drive more of their volume to Carrum, because we're going to guarantee that we'll save them money.
I promise last question. You just mentioned the magic word, PPM, right?
Yes.
So
Yes.
if you think about, we've been hearing PPM is dead, we need to pay for what's actually used. And
Yes.
then on the other side of it is, well, PPM is predictable, right? Because, here's my number of eligible people and I can manage my
Sure.
budget. So Amy's wisdom on this for the entrepreneurs that are watching?
If you want in the door, don't have a PEPM, do utilization-based pricing. We did that toward the end at Livongo. We definitely did that at Lyra, and that's what we do at Carrum. The tricky part then is you're only getting paid when they do something. So you have to have phenomenal, well, if you can get them to steer, if there's steerage from the benefits leaders, then you can get a good assurance of the utilization. If there's not steerage, you got to have a great internal marketing team that will do B2B to C marketing. We have a great one. Annie Furlong leads our team. At Livongo, we had an amazing, really all the last three
Yeah.
places that I've been have had amazing consumer marketing teams. You have to have that.
All right. I really wish we would have extended this, but Jim, over to you, my friend.
Excellent. Excellent. Oh, thanks, Amy. So,
Oh, thank you.
Amy, so we're kind of projecting ourselves out, maybe 5 years in the future, because it feels like I think you move in faster clips than everyone else. From what I can say, I usually give you 10 years. Well, so
Yeah.
5 years
Thank
from
you.
now, so five
That's
years
only because
now,
I'm old.
no, you get an email from Kent State University, and they're partnering with a number of large healthcare systems to create a conference called the Swagger Conference. And the Swagger Conference is it's a transformative healthcare conference where they're as a result of you having launched a best-selling book about empowerment and walking with confidence. And the book is written, and everyone's not just women leaders, but everyone's just getting so much from that. And so you're asked to keynote this Swagger Conference, and at the conference you have invited all different types of healthcare constituencies are coming in there. So there's people selling anesthetic surgical equipment, and people selling, different types of pre-diabetic training, and, value-based care models, and everything we just talked about there. So it's a fascinating conference, and you're giving this talk, and you're up on stage, and they're showing, and it's kind of a little emotional for you because you see a picture of yourself and in your first pharmaceutical suit with your bow and your and your Pontiac walking into your car, and there's Bill and Bob on the things, and you're giving this talk, but you look out in the audience, and there's this dynamic, beaming woman that's about 3 rows back, about 2 seats in, and she's just been staring at you, and there's been something about her the whole time, and she's just been looking at you, and the conference ends, and she swaggers across the room, and she just stops you, walks through all the crowd, and Glenn Tolman's trying to reach you, and Bill, and everyone's trying to talk to you, and she just says, "No, I have to speak to you." And she goes, "You don't understand, Amy. I need to talk to you. I'm the oldest child. I have three sisters and a younger brother, and we grew up in the middle of America. And I went on to sell hospital-based medical equipment. Then I went on to work through different parts of the healthcare system. And now I'm about to launch my own company, value-based care, entrepreneurial endeavor." And you look at that younger version of yourself, and what would be the one piece of advice you would give her?
You're making me cry. um, I would tell her to focus on her family.
Amazing.
And not that I didn't love my family, but I was the breadwinner. And so I felt this, and I have a family with amazing work ethic. And so when after 9/11 happened, and uh, there was a furlough for airline pilots, I was like, we got this. We're just going to keep on marching, and we're going to be fine. And I kept on going. And I should have paused and focused on my family. And so that's what I would tell her to do. And so that's what I'm doing now. I have an amazing family, 3 kids, a fabulous husband, and I'm going to focus more on my family. In fact, that's what I'm going to be doing in the next 3 years. So,
Amazing.
sorry to get emotional, but I love how you set that up, Jim. And that's what I would say is focus on your family.
Amazing.
Family first. Love it. Amy,
Yeah.
thank you for joining us. And for all of
Thank
our
you.
wonderful listeners and viewers, hit subscribe, pass it on, and we'll see you next week in our last episode of the year.
Thanks, everyone.